I love that. I appreciate everybody taking time out of their day to come to this. We're going to talk about the hazardous drugs program that came into play, actually a very long time ago, but became a federal guideline in 2023, in November of 2023. Now it's trickling down to our level of med administration and that kind of stuff. So Corey, who is the chief pharmacist at Lewis, is going to actually talk to us about things that we can do. We do deal with a few of these meds, and he's going to explain that to you in a little bit more depth. So please welcome Corey.
Alright. So we'll keep it pretty brief, and then we'll have a lot of time for questions and discussions. So in this PowerPoint, we're going to try to explain the NIOSH, which stands for the National Institute of Occupational Safety and Health. So it's their hazardous drug list and why it exists. We're going to talk about how to identify the hazardous drugs, how to minimize your risk level, and then some time for discussion. So, like Julie was saying, this kind of came about with actually when they redefined USP 800, which is kind of a broad sort of guideline for different types of drugs. A lot of it has to do with sterile compounding and kind of the chemotherapy stuff, which we'll get into in a little bit, but also some of that applies to kind of sort of our outpatient setting like you guys deal with. So they published a list of agents in 2016 that are considered hazardous, and so they're setting the standards of how to handle these drugs safely to minimize risk for healthcare personnel, patients, and the environment. So what they did in these lists is they organized these drugs into 3 different tables. And so table 1 is, like I said, generally going to be your chemotherapy. It's generally going to be, there are a few outpatient meds, which we'll get to in a bit, but generally you can think of that as your chemo, cytotoxic agents that you obviously don't want to be touching. We're talking, sterile hoods in the hospitals, the gown, the mask, all that sort of stuff. Table 2 and 3 are going to be more your non-cancer drugs that still meet some sort of hazardous risk, and primarily that's going to be a reproductive risk to men and women both, and so that's we'll get into here in a bit. So which drugs apply at LifeQuest? Again, right now you have no table 1s for any resident at this time. A few examples of more the outpatient table 1s would be like methotrexate, oral chemo, also used sometimes for like rheumatoid arthritis. Tamoxifen is an oral breast cancer drug. The 5-FU, which is like the cream for skin cancer, that would be on there. But those are kind of the main examples of table 1. Like I said, at this time there are none. The table 2, you can see is sort of kind of a list of everything. A few to note there: the estrogens, so the birth control pills. It's got some of the psych meds on there. Like Cellcept is a immunosuppressant for like kidney transfer or organ transfer. Spironolactone is on there. And then table 3 is just, again, kind of all random different types of drugs that you're going to see here in your setting. So as far as the transport, doesn't affect you guys a whole lot, but I just wanted to throw it in there. So the table 1, which you don't have any at this time, we would send those in a hazardous drug baggie, so that it's very easily identified that you can see this is a hazardous drug. Table 2 or 3, technically, since it's already in a packaged form, the transport is not going to look any different other than the way it's identified on the packaging method, which we'll get into in a little bit. So, and also of note there, which we'll talk about here, any table 2 or 3 that is split which we'll try to avoid at all costs. That becomes a table 1 since the tablet is not whole. It's kind of a little more of a risk, I guess, so that technically increases the risk.
Thank you.
So mainly we'll get into here how to identify a hazardous drug for you guys when you're administering meds or watching, people administer meds. So we have a couple different methods here. Most people probably should hopefully be familiar with our smart packs. On our smart packs, we are going to identify the hazardous drugs in blue. Right now the controlled substances are in red, and then everything else is in black, and then there'll also be a yellow HD or hazardous drug sticker to let whoever is dealing with these packs know that at least one drug in that pack is hazardous. So hopefully that'll help kind of identify those in an easy way. And then with the blister cards, again, if the tablet is not split, it'll just come in your normal blistered card with your hazardous drug sticker. And if it is split, that's when we would send it out in a contained plastic bag. And then any creams, ointments, liquids, anything that's a bulk product, we will also have that yellow sticker on, which I think we only have a few in the whole
I
facility.
think North Kimball, who's here from North Kimball? Okay, you'll have that valproic acid syrup from Marty,
Yeah.
will come with the sticker on it. Yep, yep. We're gonna try to get him switched over to a tablet.
Oh.
Okay,
So, getting into how to protect yourself. So what kind of PPE do we need? In general, again, since we're not dealing with, chemotherapy, we're dealing mainly with tablets, capsules that are on the list of table 2 and table 3. So in general, the recommendation is gonna be anytime you're dealing with those tablets, capsules, also creams or liquid, you're gonna want a chemo rated pair of gloves, which I think Julie will probably get into after I'm done here. But that's gonna be, 90% of the situation here, where that's basically gonna be what you need is the chemo rated gloves. There are also, I think, other PPE is gonna be available based on certain situations. So some situations that would maybe come up, like I said, the half tabs, technically, if something is half, let's just say warfarin, for example, it's on the HD3. If that's halved, it's not, again, since it's a tablet, most of the time with the glove, you're gonna be just fine. Just know that technically, the powder, whatever situation, you could, in my opinion, probably don't need a mask. If you want a mask, since it's, not an intact tablet or capsule, I think that would always be an option. Creams, I think you said we have 1 or 2 creams currently that would be on the list. Do you wanna talk through that as far as the administration?
Centennial, you have both of those creams. It would be the
Tretinoin.
Tazarac cream and the tretinoin cream on there. Jenny, I believe, does her own. She just needs to be sure to wash her hands afterwards, or wear a glove, to do the application. And Bob's, when he uses his, you need to make sure that you have gloves on and that you're using a Q-tip. I don't know if he does his own, I don't know.
Yeah, he does.
He does do his own, so same thing, he would need to either wear gloves or wash his hands after applying.
And then, liquids and spill kits, we'll probably just save that to the end, but. So, table 1, again, those cancer drugs, according to the guy, there's absolutely no splitting or crushing of those, it's just not an option. Again, hopefully we won't run into that. There is one mycophenolate, which is on table 2, which you cannot manipulate the tablets or capsules, but we don't have anybody on that right now. But otherwise, just be aware that ideally we don't wanna split any drug on this list, only if you absolutely have to. So again, we're gonna try to avoid splitting or crushing as much as we can. So.
We're actually gonna be talking with the medical providers, about not prescribing anything that comes in a half tab if it's on this list. the other part of that fight will be getting Medicare and Medicaid to pay for the options that would go around that half-cap, so.
So we'll try to avoid it if at all possible is basically the bottom line. And then destruction, of course, part of, making sure these drugs are, not affecting the environment and things. There's some guidelines on the destruction. In this type of setting, it's pretty generic. It's pretty much common sense, I would say. So, we're basically, I think when Julie and I were talking, any missed dose change, stuff like that, probably don't want minimal handling as possible with many, so probably mostly going to be sending back to you for destruction. And then I guess I don't know what exactly you decided with your PPE. I think technically you can throw that in the regular
I
garbage.
think that's what we're going to do,
So.
is put in regular garbage, unless we run into the other situations where we have a higher level hazard. We have not had that, so don't anybody freak out about that, and, yeah.
So bottom line is, if you're administering a hazardous drug with the chemo-rated gloves, those can go in the regular garbage at this time. And then just making sure those meds sent back for destruction. How you want to talk about how you want to do that?
We had a brief discussion about that with the supervisors and the support specialists last week. If you know you're dealing with a dropped med that came from an HD.
Did you come out more? We've got people over here.
No, we're stuck here. So if you know you popped a pill out of here, it falls to the floor, you know it's got an HD sticker on it. With a gloved, chemo gloved hand, make sure you pick that up and put it in a Ziploc baggie, okay, to send back to me. You still have to write the name on, because I'm not gonna know this pill from Adam. So write the person's name and the name of the drug on the outside of the baggie, so that we know, and Janelle knows, because we are the ones who destroy all these medications. So we have to have that advance warning from you guys that that's what we're dealing with now. So, thank you.
And then your cleaning supply spill kits, I'm gonna let you talk about that, because I know that's kind of different everywhere you go, so.
Okay.
As far as what's in your
Okay.
spill kit, and then I think that is the last slide, so.
Okay.
Kinda get into
All right, so these are the HD spill kits for PPE that are going to be located in every med room. Okay, they'll just be in the little plastic tubs. Different from your regular spill kits that you clean up messes on the floor, or whatever, that are in the vehicles. This is specific to the HD drugs. On there'll probably be another training down the road when we figure all that out about what would need to happen in the event of a spill. Marty's whole bottle spills, okay, and it's a full bottle. What is that whole 400 mils?
Yeah.
Or thereabouts?
Roughly.
That's considered a large spill, okay? So we would need to have some special things in place for something like that on there. For a regular spill, there are some specific wipes. Justin, where are you? Are you here, Justin? John, okay. Okay, you have to use this type of a wipe to clean up spills. Whether you don't want to spray on anything because it spreads the dust up and through the air. So you want to make sure you take this wet wipe, has to be the sandy wipe, and make sure you wipe down all the corners, any places that have been touched, or possibly touched by that. Not these. These are for regular stuff. This is for the HD level cleanups if we need them. Gloves,
Julie, quick question.
yeah.
Those will be provided to the houses.
Yes. Where my purple bugs went?
Right here. It's my selfie stick.
So sorry. Okay, so these kind of gloves for administration, no. These gloves for administration, no. Okay, that administration can only be done with the fit guard. They'll have a little thing on here that says they're chemo rated on the back. We will be providing these at the houses, okay? So these are only for med administration, okay, from now on. So they're here, they're gonna be starting to be sent out soon, so. All right, so that's for the main med administration. If you get into a spill situation in the PPE kits, we will have the N95s. I'm not sure if it'll be this exact style. If we would get into a large spill and need to clean up along with the gowns and face shields, just in case you have a super huge. Hope not, we don't ever have that kind of bulk or quantity here, so I don't think that will come into play. So, if you have any houses that are crushing medications, we're gonna go to this style of crusher, okay, called a Silent Night. There's a little baggie holder in the back. You open the pills, you put them in here, you slide them in. Oh, I don't think I can hold this, is heavy. Okay, put the pills in the baggie, you slide it in here, and it does not take much pressure at all, it's just a quick like that, and it should crush. You may have to do it a second time. When they come out, they're all crushed for you and ready to put into applesauce or whatever medium you use for administration. Okay? Okay?
That's good.
So, and those of you who do G-tubes, so this will be something you will have at your location on there. So, any houses in here besides GSA crush? Any that's, you do crush down there? Okay, okay, so I'll send you one as well, okay? Okay, let's open it up for questions. Who's got questions?
Those pills that can't be split or, crushed, will those be specified on the prescription that are sent?
Yeah, so, again, the only thing that technically can never be, split or crushed are the table ones, and we don't have any of those right now. So technically, your table twos or threes can be split, they just say only split if you absolutely have to. And so, like we were saying, in general, you know, if you have a warfarin order and there's, you know, they're saying 5.5 a day or whatever, we would maybe try to switch that order so you don't have to,
We only have two
Split or
houses, so
crush.
Kendra, that would be your house, and Wheat Ridge, that would be yours, where we deal with the warfarin.
but yeah, if it comes out, you know, if it's, first of all, if it's scheduled and split, it may be, we haven't really crossed that bridge yet, we might put it in a card versus actually putting it in the smart pack. And then that's where the card would come out, a sealed, hazardous bag around it and such. So yeah, it'll definitely be easily identified if it's a split hazardous drug.
Mycophenolate is the other name of that CellCept? Is there
Yes,
another name,
correct.
CellCept? Okay, Shelby, you've got two.
Oh, you
on
do
your
have two
caseload that
mycophenols?
have,
Okay.
they're not in this building, and we don't administer any of those
Sure.
meds, but there are two that take that.
Yeah.
So,
And generally, that's not gonna be, that dosing is usually, it's not gonna be a half,
okay,
generally, that I've
okay,
seen. It's gonna be a full capsule usually.
Yeah.
Or tablet.
yeah, and they both have tablets, I feel like. So, okay. What about disposal of the empty smart packs and blister cards that have contained an HD drug?
Yeah, I mean, generally what I've seen is the risk, I mean, they can go in the regular trash, cause it's, like I said, the table twos and threes are very low risk as far as like environmental wise for disposal. If we would end up getting a table one, we may wanna discuss a different method, but,
Absolutely.
so,
In all the years, I've been here 27, 28 years, we've only had one table one drug, and actually the drug was administered at the hospital, and then that person came home and, recovered at home. So we
Sure.
did have to take some extra precautions at that time, as far as taking care of body fluids and, that kind of stuff, so. Long time ago. And actually, it's moving off the list now. It's moving off, BCG is moving off the list, so, all of the lists. So, the fun part is we'll get this all up and running, and then when the
yeah.
2023 list comes out, it'll all change. Because things are gonna go to table one and table two, and some things will shift up to table one, some things will stay in table two, table threes are being absorbed into table two. It's a mess. But that hasn't come out yet, that's still in draft form, so
Yeah.
I'll be keeping an eye on that.
Julie?
Yeah.
On the, on the second med check, we have to mark on the control. Is there gonna be any different on the hazards then for second med check? No? Julie's the
No,
same?
just, if you're flipping the cards, just put your
Just
gloves
check
on. Yep,
Gloves on?
good question, yes.
Okay.
So Julie,
Yeah.
I know there's supervisors in the room. Are we talking about differences in storage? Do anything any different there?
I'll let Corey speak to that.
No, they generally say, since they would be contained in packaging, like they would be contained in here or contained in the blisters, you don't have to store them any different.
What about the liquid, like tartaric acid?
Yeah, that's a good question. I don't, again, those are contained. I don't know. I haven't read through the guidelines super in detail as far as liquid storage recently, but I don't think you have to do anything different, especially if they're at table 2 or 3. So,
That's what I have seen.
okay.
It's more just knowing and being aware
Yeah.
of what, you know, the potentials are there. And that's the purpose of doing all this, is to make everybody aware that it's out there. We need to be doing what we can to minimize that possibility, so.
And again, most of the, the table 1 is the, the chemotherapy drugs are where you have an inhalation risk and all that stuff. Here, it's more topical, this is why the gloves, if you have gloves on, your risk is essentially being mitigated, because the main risk with these oral tablets and capsules are technically, if you're touching them with your bare hands, they could be absorbed a little bit, and you have some of that reproductive risk especially. So gloves should cover you. We're not really dealing with inhalation risk or any of that sort of stuff.
The
So
only thing that I could find with inhalation risk was with the crushing, which is why we're
Yeah.
going to this style of crushing, cause the dust, as you
Right.
do the old crushers, you open it up and that dust can go
Right.
flying. So that's why we went to this type of crusher
Yep.
instead.
that way it's contained in a baby.
Go ahead, John.
Those Keurig gloves, so you don't want me to send them out anymore?
I think we're at the point where we can send them out, okay? Please, they're used in the bedroom, okay? I don't know if we're gonna go all agency, for personal care and that kind of stuff. Since everything can go in the regular garbage, I feel like we can stay with standard gloves for personal care and that kind of stuff. So, the purple gloves will be in the bedroom, okay?
What about for the people, like when they take their meds with their hands, do they have to worry about anything? Should they like?
No, because they're taking them in, but they should
But
wash
it's
their
still
hands afterwards so that they're
afterwards,
not
they should
touching.
wash
Yep,
their hands.
before and after, if they want to go
Especially if
perfect.
it's cream or,
Yeah.
yeah, the
Yeah.
capsule or tablets going in their body, so they're,
If we're cleaning up accidents, should we wear the chemo-rated gloves?
I don't think you'll have to, because it's all standard, because it's processed out pretty much, unless we get into some table ones.
Yeah,
And that
that's a
would
good
be a
question.
circumstances situation.
Yeah.
Okay, good
Good table.
question.
Yep.
So,
So, one of the things we'd like you to think about, is, how might people be more independent in taking their medications? Because if they can, then that risk is lower. So as you're administering medications and thinking, maybe we could work on this so Josie can become more independent and being able to take her medications. That's something that we'd like you to think about and share your ideas with your supervisor, so that would be helpful as well.
all those med assessments that you guys have been working on, that was the whole goal of doing it that way, was to get more independence. And that will help you look and see what you wrote on those med assessments. They're in the plan section. No, where are they? Support specialists, where are they held at? IDF? No. Oh God, look at me trying to think I know those terms. I don't know those terms. For that part, but I look at them, see what you identified as ways to increase their independence. That'd be awesome. Good questions. Do you guys have anything? Nothing? Anybody else? Alright, thanks everybody for coming.
Do you have an outline, Julie?
Oh God, yes, oh God, don't leave without saying this. Oh, I didn't hand it out on purpose because I didn't want you to sign it until you heard it. Thank you, Pam. water and a whole bunch of cans.
I don't know.